Good afternoon, Hudson County. Welcome to Hudson Health. My name is Alfredo Rabines, Chief Medical Officer at Bayonne Medical Center, Carepoint Health. I've been with Carepoint Health now for about 6 years in the town of Bayonne. I serve the wonderful community of Bayonne as an emergency medicine physician and as a Chief Medical Officer. The pandemic has brought the community together to help healthcare improve in our town. We are very proud of the services we offer at Bayonne. And the COVID pandemic has brought to us a lot of perspective as to how our hospital can grow as an institution. Carepoint Health now, for about 1.5 years, has been led by Dr. Ajintha Mullick, who is our CEO. Dr. Mullick is a pediatric cardiothoracic surgeon who has led the organization in developing programs that will help the future of Hudson County. The needs of Hudson County are there for healthcare. We need pediatric services, we need more OBGYN services, and we need more primary care services for all of our patients and all of our friends. We are committed as an institution to be able to provide this for all of you. And here today, we'd like to share a little bit about ourselves and a little bit about what each hospital is ready to commit to you. My service at Bayonne has been primarily in the emergency department to start. I've learned in that arena that the community is a wonderful, friendly community ready to really get involved with anything the hospital wants to provide in regards to their care. We have developed a lot of programs in our Cancer Institute in particular. We have noticed that in the past, because of the pandemic, the screening protocols for cancer has significantly decreased. A lot of patients have delayed their care, delayed their screening because of lack of appointment and availability for screening services. We now have increased the availability of screening at Bayonne through our program. Patients across the country, as you may know, have decreased about 86% of their screening for breast. About 84% of the patient population has not received their cervical cancer compared to 2019. Be aware that we run a lot of mammogram programs for patients who are in need. And we also do prostate screening, and we also do colorectal screening. I'd like to now introduce one of my colleagues, Dr. John Rimmer, who's over here to my right.
Thank you, Dr. Rabines. My name is John Rimmer. I am the Chief Medical Officer of Hoboken University Medical Center and also serve as the Director of the Emergency Department. I've been with the hospital for a little bit more than a decade now, starting out initially as a nocturnal emergency physician. And I think that's where I really grew my attachment to the community. When I would walk to work at 7 o'clock at night, I would look around to my friends and neighbors in town and feel like I'm responsible for them overnight if there was an emergency. And and I truly use the word emotional for that aspect. It was an amazing amount of responsibility, and also as a young physician, it allowed me to grow a certain level of confidence. As I progressed through my career, I became the director of the emergency department in 2015 and helped grow the department, modernize it, and through some significant challenges, especially over the last year and a half with COVID. I became chief medical officer of the hospital earlier this year, and I'm excited to help reintroduce the hospital to our community, allow the hospital to evolve, to reflect our changing community, the growth of our community, and as Dr. Rabines pointed out, really hone in on certain service lines with which our community deserves and requires. I'm like a typical middle-aged young professional in Hoboken and Hudson County who I spent a lot of time in New York City, in Manhattan. I met my wife there. We had our first child there, and we moved to Hoboken. Now I take care of my friends and my neighbors, and again, back to that level of emotionality that comes with the responsibility of that. And I look around at my neighbors, and I see a youthful, engaged community with which still feels like they have to go to New York City to acquire care, and I want to help change that. I want people to feel like they can depend on a community hospital, which is down the block from them. We want to provide reproducible care that's high quality, accessible, with cost efficiency, and we're going to get there. Through the last year and a half, we certainly learned a lot. In some ways, it was our most difficult, but also our finest hour. And as we emerge from COVID, we have to evolve our care cycles and how we approach patients. A lot's changed in the year and a half. How patients are acquiring care, how technology is engaging with care cycles, and how we can better approach patients clinically using technology to bilateral advantage. So I'm excited for the next few years of Hoboken University Medical Center, and as we grow and better engage with our community. I'll hand off now to Dr. Angel Lazo from Christ Hospital.
Great, thank you. Yeah, good afternoon, everybody. My name is Dr. Angel Lazo. I'm board certified in internal medicine. I'm actually trained here in Hudson County, trained at the medical center, graduated, and just basically stayed to be able to serve the community. My purpose really was, this was actually the community that actually trained me, and my way of giving back was actually staying in this area. Hudson County is a very diverse area. It's probably one of the most diverse cities, counties in the state of New Jersey. Specifically, Jersey City is extremely diverse. We have everything from, higher end from the waterfront, and then moving inland, we have just about anything and everything you could basically name. That's why I decided to stay actually in Hudson County to be able to serve this area, especially the underserved patients of this community. I've been actually with Carepoint since its inception, when they first started. So I've been with them actually for a while. My goal obviously is, to help provide the population health needs of the community. I'm currently now the director of the COVID Institute of New Jersey, which Dr. Mullick had instructed me to go ahead and start. And we're very involved in Hudson County actually with COVID. I mean, as you guys know, all three hospitals basically got hit really hard from COVID. And COVID has showed us actually a lot of lessons, not just the role of government, but also the role of healthcare and how it impacts everybody. So we're very eager to talk to you guys, let us know what we have to offer. There's a lot of programs that are very, very unique and very specific actually for our community. And we'll hope to share that with you today.
Dr. Lazo, how can someone get an appointment with the COVID Center?
Yeah.
How do we go about doing that?
Yeah, very good question. We actually right now are operational. Our number is very easy. It's 1-866-COVID-NJ. And that phone is answered pretty much 24/7. It's a call center that they call into. And then they're screened and they're able to actually schedule an appointment. Now at the COVID Institute, we're doing a lot of neat, innovative things. We're also going to be seeing patients that are acutely infected. So whether a patient doesn't necessarily want to go to the emergency room because they don't know if they have COVID or not, they're afraid to go to the emergency room to get infected. As you know, a lot of patients are still having an issue going to the emergency room because of COVID, even though it's really slowed down. But we have the capacity actually with a hot room to be able to treat individuals that don't necessarily meet criteria to be hospitalized. We can treat them there. We're going to be doing Remeron monoclonal infusions there. We're also very big actually on post-COVID syndrome. As you know, post-COVID syndrome is a recognized entity. It was something that all of us basically predicted pretty much when we were involved with the pandemic. We knew what was going on. We knew this was just more than a simple influenza type virus that gave you a flu. There's a lot of medical conditions that are actually related to that. So we're treating post-COVID individuals. We're also going to be the vaccination center actually for the hospital and for the employees and for the community to better serve. The vaccine is actually a very hot topic, especially when you talk about COVID, especially what's going on in politics now and in general. Individuals not wanting to get vaccinated and so on and so forth. So we want to be the resource center for the tri-state area as far as information. I mean, individuals can still go to the CDC and the NIH site and other sites, but the information is becoming extremely confusing. It's very conflicting, and especially when it comes to vaccination. Our role as physicians is really to recommend the vaccination as an example. But the patients have a lot of questions. There's a lot of mystery behind it. There's a lot of disinformation behind the vaccine. So we're there not just to vaccinate individuals, but also, to provide information regarding anything relative to COVID. And then we're also going to be doing some research, COVID-based research actually there at the COVID Institute, which we're hoping to be able to get grants from NIH and other entities.
Excellent.
So very exciting.
A brand new truck isn't just a brand new truck. When it's tough enough to have best-in-class available payload and smart enough to know that a cab can also be an office, A truck equipped with best-in-class available towing that asks, why can't all that power more than just this truck? No, your brand new truck isn't just a brand new truck when it's the all-new F-150. Tough this smart can only be called F-150.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Welcome back to Hudson Health. My name is Dr. Alfredo Rabines, again from Bayonne Medical Center. We were just talking with Dr. Lazo from Christ Hospital about the COVID clinic, and we're just about touching up on the vaccine and the vaccine booster. Dr. Lazo?
Yeah, we're currently taking over the vaccination, not just for the county, but also for employees in the hospital and so on and so forth. So the vaccines are actually a big buzz right now. As you guys are aware, Pfizer just got authorized for 5 to 12, for their shots and for the kids and booster, which we should be doing. I mean, the recommendation is still to get the kids vaccinated. However, it's still a big buzzword for a lot of the parents that are unsure whether they should or should not. Our recommendation as physicians obviously is for immunization. I mean, the immunizations actually work. We know that. The fear, I think, is the new technology that actually is being used and how quickly this vaccine was actually produced. However, I think the public is not aware of really what came behind the process of the vaccination. A lot of individuals and a lot of patients, at least in my practice, are very baffled by, and that's their drawback. Like, why do I want to get vaccinated? This is something very new. I think the public is not aware that the vaccine actually has been in play for a very long time. So for the coronaviruses, which typically have pathological and benign strains, we have been working on the vaccine for a while. Now, when COVID hit, that was a completely different animal, so to speak. And I think what the government did at that time, which is basically, sit down with the industry, tell them, what do you need? Because the vaccine was already pretty much underway. And the government was actually able to supply the industry what they basically needed, and hence the vaccine came out. Now, the mRNA technology is actually very interesting, and I think it really probably is the wave of the future. But I think the fear that the vaccine came out in less than a year, and now you're talking about vaccinating kids and so on and so forth, it's becoming a little bit controversial for the public. But I think the public is just having a hard time understanding that they really are in control. Their consent is actually required. And the purpose really is to put people at ease as to what exactly is your concern.
Yeah, and I must agree, Dr. Lazo. I mean, we at Bayonne and at the other hospitals overall, getting our staff and our physicians also vaccinated has been a challenge. Yeah. We have our overall staff has been vaccinated about 84% of total. Wow. I think that the importance is the education piece, as you mentioned. I mean, I think physicians and the community need to really engage themselves in what it is the vaccine is offering and what how safety they will receive from getting the vaccine. And that education needs to happen consistently and often as possible.
Yeah, I look at it like you have two choices right now. The COVID, especially with the Delta variant, it's ubiquitous, and if you live essentially a functioning member of society, whether you go to the grocery store or ride a bus or take a trip on a train or plane to see a family member, you're going to be exposed to the virus eventually. The COVID is not going away anytime soon. So you either have an opportunity to either get the virus, which you're eventually going to do statistically if you're not vaccinated. And we know the risk associated with the actual virus, especially if you have comorbidities or are above the age of really 55 to 60. And then you have the vaccine. That's your other choice. And while we look at any therapeutic or preventative therapeutic, meaning a vaccine, from a risk tolerance perspective and potential side effects, the statistical risk from a vaccine is still far less than the risk from the actual virus. So, the vaccine is proven to be a preventer of death. at least in my hospital, we have not had anyone expire from COVID that was vaccinated. So I believe it's 100%. This is now a 100% preventable death. We've had a few breakthrough cases of COVID with vaccinated patients, but they've all been mild symptoms, more like a common cold. And that's a very important thing to distinguish, I feel, is that even though the vaccine is not maybe 100% preventing you from getting COVID, it's 100% preventing you from becoming hospitalized or even worse.
And if I may, just to offer the community of Hudson County, all three hospitals are committed to serving the community in vaccination process. So please touch base with the hospitals, your local leaders, to find that information out. And we welcome you. And at this time, we'll take a break. Thank you.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Hi, and welcome back to Hudson Health. I'm Dr. Alfredo Rabines, Carepoint Health. I'd like to talk a little bit about the COVID vaccine and testing. Our team was just talking about the services we have at Bayonne Hospital, Hoboken, and Christ Hospital. We want to inform the community that we are committed to serving our patients in the COVID vaccine and testing arena. As a matter of fact, we are very confident that we have a safe environment to provide the patients when they come for any type of surgical procedure or any care in general. The hospitals have all temperature screening protocols, all safe distance protocols, and hand washing techniques where our employees and all staff are well protected, vaccinated, and practicing safe measures. We at Bayonne Medical Center have a new Heartburn Center, which we initiated just about earlier this year. The Heartburn Center is promoting capsule endoscopies, esophageal manometry, and pH testing. These additional services to help promote like a well-rounded care to heartburn. I mean, the institution is committed to providing a holistic approach to medicine, really patient-centric care. And in order to do that, the patients need to feel safe to come in to do these procedures. Each patient that comes into the hospital is tested for COVID with PCR and/or antigen, depending on the study. And we make sure that we guide you through the hospital process so that you know that we are making the environment safe for you and your family. The Heartburn Center has been quite a success, led under Dr. Ramasamy with the assistance of Dr. Paragi. We have a well-rounded nursing team, and we were really proud of what we can do to help our patients with heartburn. I know that Hoboken University has also some leading projects. John?
Thank you, Dr. Rabines. Yeah, I think, to get back to the point about testing and patients feeling safe to return to hospitals, I believe personally that it's probably safer to be in a hospital right now than it is to be in Trader Joe's or on New Jersey Transit. I think everybody in a hospital, every patient in a hospital is tested for COVID. When you come in with classic symptoms for COVID, you are isolated immediately. Our hospital staff is almost 93% vaccinated. And the few employees that are not vaccinated are tested weekly. So we have excellent surveillance of not only patients, but also staff. So I want to give patients confidence that when they come to a hospital for whatever need it may be, whether the emergency department or screening or preventative visit, certainly that they can have confidence that they're not going to be exposed to COVID and/or their risk going to be minimized. I just want to talk to a little bit about our emergency department. It's near and dear to my heart. Again, I'm board certified in emergency medicine and internal medicine, and throughout COVID, we have seen a significant, concern from patients that are voiced as far as, is it safe for me to come to hospitals for my chest pain or my dizziness or my shortness of breath or my leg swelling or whatever symptom it may be. And I want to assure the public that it is safe to come back. We want you to come back. We want you to get care. As an emergency physician, something that I didn't realize when I was starting out in this career is how many patients that I would tell that they have cancer. If you're coming to an emergency room and I am diagnosing with cancer, it's usually an advanced stage. And that is something that surprised me as an emergency physician. I was taught very well how to give bad news to people, but when I have to tell them that they have cancer, it's something that really strikes me deeply. And I think, through the pandemic, as we noted, there's been a lot less preventative screenings, a lot less active maintenance of care. And as a result, we're seeing more advanced cancers pop up in ER visits. So that's troubling. So I want to assure the public that it's safe to come back to your hospital, to your doctor's office, to get those screenings. Our emergency department itself is spacious, it's modernized. Before the pandemic, we would see about 42,000 patients per year, but we're built to see more than that. So we have ample room. Most of our rooms are all private. Our door-to-provider times are usually within 25 minutes. And we have all the services of a modernized emergency department, including a pediatrician in-house 24/7, which is rare for a community hospital. But we understand and recognize the importance of pediatric accessibility in our community, especially in Hoboken, Jersey City, Union City, with which the average age is youthening. We have a full array of medical and surgical specialists, from neurosurgery to thoracic surgery to vascular surgery to pulmonology to infectious disease to cardiology to critical care. And for a community hospital, that's actually a fairly deep bench of specialists that are on call 24 hours a day to meet your needs. And our emergency physicians themselves, we have 11 full-time physicians that are at Hoboken, and we share some emergency physicians across the system. Everyone is board certified. Some of them are even dually board certified. One of our nocturnal physicians is board certified in emergency medicine and pediatrics. So there's a lot of expertise and longevity. Our emergency physicians, we haven't lost one in more than 4 years. And so there's familiarity with our system, with our patient population. And again, I come back to that experiential level that's required in emergency medicine. We understand that when you come to an ER, it may be the most stressful 90 minutes of your entire year. And we want to help alleviate that stress. We want to help explain things, provide updates to your care, and then hand off care back to your community physician seamlessly. So we're excited for you to come back to the ER when you need us. I hope you don't, but if you do, we're ready for you.
Thanks so much, John. Next up, we'll talk about the Momentum Center with Dr. Lazo. At this point, we'll take a break. Thank you.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or a quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, Hudson County. We're back with Hudson Health. So Dr. Alfredo Rabines, welcome. We were just talking about the emergency care at Carepoint Health emergency departments with Dr. Rimmer, and we'd like to keep the momentum going. No pun intended. Dr. Lazo from Christ Hospital is going to give you a little bit about our Momentum program, our project. It's really exciting stuff. So I'm going to pass it off to Dr. Lazo.
Thank you, Dr. Rimmer. Yeah, very exciting things happening actually in Hudson County. We are the leading institutions actually in Hudson County, Carepoint, because we have the 3 hospitals, Bayonne, Hoboken, and Christ Hospital. Now, each one of us has very specific service lines, to be able to serve geographically the community. Population health is a big buzzword right now. And since we are in the COVID era in our thing, Christ Hospital has actually developed the Momentum Bariatric Program. So especially under the COVID era, one of the comorbidities is very strong, especially for poor outcome with COVID, is being overweight, being obese, diabetic, or pre-diabetic. So the Momentum Center that was created actually at Christ Hospital addresses all those issues actually. It's not just obesity, but it's also weight control. They're having a diabetic program starting there as well. So we're very excited to be able to offer that because it's extremely prevalent. And especially in the COVID era, these are the population health issues, that Hudson County really needs to be worried about. And we're there to help you.
Can you maybe talk a little bit about how diabetes is even considered maybe almost a surgical disease now, in the sense that how weight loss surgery is part and parcel to the Momentum Center?
Yeah, it's humongous. I mean, the prevalence of obesity, not just in our community, but in the nation, is just overwhelming. And again, it almost runs hand in hand with insulin resistance and actually with diabetes. So we're actually doing bariatric, have an active bariatric program to be able to help the community. It's just incredible the outreach that we've actually done to this community, and we're seeing a lot of that pay off right now. The Momentum Clinic is actually getting extremely busy. So,
Thank you, Dr. Lazo and Dr. Rimmer. Thank you both. And I want to say thank you to Hudson County for supporting our institutions for so long. We're very proud of what we do. We're very focused on preventative care, and now with Dr. Mullick at the head, we're really focusing on service line initiatives and just helping the community overall in a bigger and better way. So thank you so much. Enjoy the rest of your day.